Welcome back to Countment Electrohomeopathy Forum West Bengal. Last episode of Angioitico-1 we had completed up to the digestive system, the effect of Angioitico-1 on digestive system. After that, today we will discuss about the remaining part. First, let's come about the electrohomeopathy and its effect on female. So it is a good remedy used for the bruised part after labor, erosion and excoriation of cervix, uterine hemorrhage, for mechanical injury after position, sometimes soreness in nipples, mastitis which occurs due to injury, tumors of the breast, nipple retracted. In this case, C1 must be used with Angioitico-1. Uterine polypi, there also along with Angioitico-1 we have to use an L1, lymphatico-1. In cases of amenorrhea, dysmenorrhea, we use Angioitico-1. But in case of dysmenorrhea, yellow electricity must be applied over the hypogastric region. Sometimes we get female suffering from metrorrhagia, where too frequent and copious menses occur. In that condition, Angioitico-1 must be alternated with canceroso-1. Sometimes we get sore pain in womb on rising, menorrhagia, pruritus vulva with profuse leukorrhea. Here also in pruritus vulva we use canceroso-3 with L1 followed by Angioitico-1. Menses have some time offensive and profuse scents. Soreness of breast before menses, we get complaint of itching of axilla, climacteric disorder, leukorrhea before and after menses with bloody, dark, offensive discharge. There too, Angioitico-1 must be used with this C1. In cases of uterine hemostatic and vasoconstriction, metrorrhagia, especially from fibroid tumor and hemorrhage, there too Angioitico is very much effective. Now, when we come within the range of this urogenital organ, here sometimes patient complain of retained urine from overexertion. Here, scrofuloso-6 is the remedy. But due to exertion, if it occurs, then along with Angioitico-1, if scrofuloso-6 be given, then there we will get good result. Sometimes we get pain of spermatic cord that becomes very much sensitive to concusssions of walking or riding or cycling. There Angioitico-1 alone act nicely. In chronic cystitis, hematuria, renal colic, there too Angioitico-1 is good remedy if used with scrofuloso-6 and canceroso-6 alternatively. In cases of vesical tenesmus with very painful micturition, there too this Angioitico-1 to be used with canceroso-2. In cases of frequent desire, urine heavy, phosphatic, urethritis, often replaces the use of This your catheters, there too we get good result if Angioitico-1 is applied along with green electricity. In bleed discharge, gonorrhea, discharge thick and yellow, there it should be used with Consorcio 5 and Venerio-1 alternatively. In respiratory cases, if you get valvular disease with lung development, phosphates in urine and loss of flesh, frequent fainty smells with cold sweat all over the body, burning soreness in right chest throughout to right shoulder, all bone and cartilages of chest that becomes painful, severe soreness under right nipple, cough depending on this your cardiac lesion, paroxysmal at night during sleep, cough with burning pain in chest, feels suffocating when lying on left side or right side, pain from chest to left shoulder, severe dyspnoea and constriction of chest. In these cases, Angioitico must be used frequently. If we use this Angioitico-1 in 100 ml of distilled water, dissolving 10 to 20 globules of Angioitico-1 and advise the patient to take 1 teaspoonful every hourly, then it works nicely. In aphonia, cases of gastric origin released by eructation, there too Angioitico-1 must be used with scrofloxacin hemostasis from suppressed menses. Sometimes you get this one, and there too C1 and S11 is to be used along with Angioitico-1. In cases of blood expectoration, dyspnea with hemoptysis, acute tonsillitis, swelling of soft palates. So in cases of this your acute tonsillitis, it is to be used with Consorcio 3. But when soft palate is swollen and alveolar, and that also becomes painful, there Angioitico-1 is to be used is Consorcio 3. In cases of pneumonia, P3 is to be followed by this Angioitico-1 hoarseness due to overuse of voice. There too, along with P2, this Angioitico works nicely. Bronchial catarrh, latter stage, dry, harsh cough. There, P1 is to be used with Angioitico. Bronchitis in cold, exhausted person with a thick yellow tenacious expectoration, there this Angioitico-1 works nicely if used with petrol thin. In cases of whooping cough, spasmodic cough, after influenza and after whooping cough, we use this Angioitico-1. But it should be remembered that in those cases, P3 works nicely, where P3 must be the main medicine, followed by Angioitico-1. Then edema of larynx, trachea, this soreness, heat and tension behind this our sternum, offensive breath and turbulent expectoration, asthma with this your stomach disorder. In these cases, this Angioitico is also useful. Now let's see the effect of Angioitico-1 on extremities, on limbs. So remember, Angioitico-1 is very good in all cases of injury, whatever may be the type. If any pain, arises due to injury, there Angioitico-1 is the must remedy. The patient gets pain in back and limbs if bruised or like beaten, gout, sprain and dislocation feeling, soreness, overexertion, bruised pain in this your pelvic region, strength of the hand and limbs diminished, rheumatism, left hip joint, nape of the neck, painful, dull, heavy dragging pain and stiffness of this your lumbosacral region. There, this Angioitico-1 is to be alternated with cancers of eye. There we will get very nice result. In cases of skin disease, where we get black and blue spots due to injury, itching, burning, eruptions of and small pimples, crops of boils over the body, bed sore, acne, eruption like this your variola, lupus, ulcers, cancerous formation, red blotchy eruptions, burning and this your itching, acne with scanty menses. In all these cases, this Angioitico-1 is to be used with cancerous theory. Now, in cases of fever too, we use this your Angioitico-1, where fever symptoms closely, if related to typhoid, shivering our whole body. In that case, favourably 2 and white electricity is also to be used. Heat and redness of head with coolness on rest of the body, internal heat, feet and hands. In there we get coldness or cold hand and feet. Sometimes if in cases of fever, there be nightly sour sweats. There too, we use Angioitico-1 along with favourably 1 and sclerosophy. So in this way, if Angioitico-1 we use, then a large number of area or disease we can cover nicely. Angioitico-1, this is a blood medicine. So what relation we described here, if we properly followed, then I think we will get result more than our expectation. So my friends, be careful and very sincere while using Angioitico-1 or any medicines of electrohomeopathy. And so, before using all these medicines, must try to know the entire drug picture of each and every remedy. If the entire materia medica of each and every particular medicine be known to us, then I think we can use single medicines of electrohomeopathy individually and can get very good results. So thank you very much for today. The next video will bring electrohomeopathy and its effect on frozen soldier. So be ready. Wait till then. Thank you very much.